My name's Dr. Darren Sharpe. I'm the Deputy Director at ICC at the University of East London. What motivates me in terms of my work and my research is really changing people's lives and improving people's lives. So the key principles of social justice, the idea of co-production and co-design, doing things with people as opposed to doing things for people. Me as a young person, I always enjoyed being young. To begin with, I've got lots of fond memories. For me, as a black child growing up in a white community, I was forced to recognise myself or my difference, I think at a far much more earlier age. I definitely was looking at the world through a critical lens. Where do I fit in? What is unique and special about ICC is that it brought together two critical masses of academics, epidemiologists, psychologists and sociologists, cyber psychology and cyber crime. And so what we do is really looking at the blended world of children, young people and vulnerable adults, both online and offline, and that kind of grey space in between. We're more merging and converging to this messy, fuzzy centre. And it's very much both about the health and well-being of individuals as well as their safety and security. So our work is about, yes, informing policy and practice and using empirical research to actually shape that policy and practice. I've worked in a variety of public services, and what dawned on me really was that you see the same individual or the same family from service to service to service, all treating different parts of the individual. What I want to do with my work is create social impact the individual life today or the immediate future. More recently, I've done work in Africa, in a number of countries, Zambia, Sierra Leone, Rwanda, as well as South Africa. And this was really focused around young people's mobility. So we developed an extensive network, very skilled practitioners on the ground. We had the research capacity to measure the interventions we designed and were going to deliver. Then COVID came. And then we had to pivot very quickly in terms of changing these programs rather than into employment programs, into COVID health literacy programs. But in essence, what we managed to do was shield the most vulnerable young people and families. We funded a mask-making cottage industry where they could have an income, produce the mask at low cost, which we would then distribute to vulnerable groups in our network. We really did save lives through our effort, but equally we was able to measure the impact of COVID on these young people's mental health and well-being and their educational outcomes during this period. As a practitioner, I wanted to do something. I wanted to make an impact. This was our moment in time, actually, in terms of epidemiologists, and that sustained me really. It gave me a purpose to wake in the morning, knowing that I was playing my role in terms of combating the pandemic.